I ask her to straighten her knee. All right, so she brings her leg up. Can she hold it there? If she can, hold. Let me just sit on you. That's how we're going to do that. All right, so you bring their leg into full extension. We ask our patient to hold. We provide resistance for 6 Mississippis. And then we see if we can break her or not. If we're going to test the hamstrings as a group, I just ask my patient to bend her knee, and I test her at about 70 degrees or so of knee flexion. I don't want to test her way back here, because if I do, she's going to cramp up and she'll hate me. And also because of active insufficiency, she's not going to generate much force back here, but she'll generate more force here. So if I'm testing hamstrings as a group, where I'm testing medial and lateral together, then I just ask my patient, go ahead and bend your knee up. She does it, hold strong, I give her counter pressure, and that's all we got. Simple. If you're testing the medial hamstrings, you want to medially rotate the leg and medially rotate the tibia. So medial, medial. Medial, medial, medial. Say it 3 times. Medial hamstrings, we medially rotate the hip, we medially rotate the lower leg. Now, what does medial rotation of the hip look like? If I'm looking at her left hip, am I bringing the leg this way, or am I bringing it this way? I bring it out. So that's medial rotation of the hip, and then medial rotation of the lower leg is bringing her foot inward like this. That's the medial rotation. I'm going to back you down to about 70 here. And I position her in such a way, and I'm just pushing straight back into extension. So hold, 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 hold. And that's how I'm going to isolate, or preferentially isolate, the medial hamstrings. Okay, so it's medial hamstrings. Lateral hamstrings is just the opposite. Lateral, lateral, lateral. So for lateral hamstrings, I laterally rotate the hip, and I laterally rotate the leg, and I say hold, and I'm pushing straight back. I'm not pushing in any kind of weird angle or anything like that. I'm just saying hold it here, don't only push, hold, 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 hold. Okay? That's all there is to those. What I do, and I think what makes sense, but I'm not sure whoever does this, and I want to hear what you guys do too, is I actually document how many they can comfortably, how many they can do with good form. If they can do more than 20, I stop there. Okay? Because these are the muscle groups that students will most often fail on lab practicals. In my history of teaching here, these are the 2 killers. So pay close attention to these ones. Okay? So when we do this muscle test, we have to make sure our patient everts against gravity. But I can ask her to evert and plantar flex. And again, I'm pushing downward toward inversion, and I'm pushing upward toward dorsiflexion. Okay, so remember, if it's an everter and plantar flexor, I am pushing into inversion and dorsiflexion. All right, so that's perineals, longus and brevis. I want you to point your foot downward and lift it up toward the ceiling. That's perfect. Okay, and again, if it's an inverter and plantar flexor, I am pushing in the opposite direction. So hold strong, hold, 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 hold. So I'm pushing toward eversion and dorsiflexion. All right, so that's your tib posterior. So if I want to test this one, I might want to do this in sitting, so I know she has to contract against gravity. I ask her basically to dorsiflex, bring your foot up and inward for me. Yep, and hold it, and don't push it down. And I am basically just pushing kind of downward and slightly toward eversion. Okay, so it's really a straightforward one. If I had to test this in gravity eliminated, I would do it in side lying, and I just ask her to dorsiflex. So think of this as primarily, the primary function of this is dorsiflexion. And I just get my fingers on her toes, and I just, on toes 5 through 4, and I just say hold, 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 hold. Or you could put your whole finger across the tops of her toes and say hold, hold, hold. So I'm going to do the longus and brevis together. Just say hold, hold, hold. That's how we're doing. I don't think we need to worry about testing these in a gravity eliminated position. Okay? Yep. Syncytialis longus, I will do this as part of a neurological examination, because this is a test for an L5 nerve root impingement. But I ask them just to bring their big toe back, hold strong, don't let it push down, hold, hold, hold. Very simple. You're on the distal phalanx, and I'm just pushing downward. Again, you don't have, these are like the thumb muscles. You don't have to put them in a gravity eliminated position. And often, what I will do is these ones I often test, like the toes, I might test simultaneously, so I can really get a sense, is one a little bit weaker than the other. You just asked them to bend their big toe down.
Oh,
there we go.
sorry.
Bend it down. Okay, I just want to make sure you can do that. Stabilize that proximal phalanx. Hold, 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 hold.
Oh, that's hard.
Let me pull it up. So that would be the longest, and this would be the brevis. The brevis is on the proximal phalanx. The longest, I'm on the distal. That's it. That's all there is to those.